Nearly 80% of women are suffering with, according to statistically, nearly 80% of women are suffering with the hormonal imbalances. Then, what are these hormonal imbalances and what are the types of hormones and how it affects our body? Okay, today's topic is hormones and its imbalances and what are the effects of hormones in our body. If the hormones are not properly secreting with the particular glands, what are the effects we are going to get in our body? Okay, so this is Shruti. Welcome to my YouTube channel, Shruti the nursing officer. సో ఎవరైనా మా ఛానల్ని ఫస్ట్ టైం చూస్తున్నట్టయితే లైక్ చేయండి, షేర్ చేయండి అండ్ సబ్స్క్రైబ్ చేసుకోండి. ఓకేనా? హౌ మెనీ ఆఫ్ యూ లైక్ మై వీడియో, ఇట్ గోస్ టు other people. Okay, so I'm not that much good at English. Please try to understand what I mean to say. Okay, so hormonal imbalances or the hormones. What are the hormones? First we have to know about the hormones. Okay, what are the hormones? Hormones are the chemical messengers. Okay, what are these chemical messengers? The name only suggests chemical messengers. These are the chemicals secreted by the particular glands. Okay, particular glands, and those chemicals give messages to the different parts of our body in order to function normally. Okay, these are the chemical messengers. Okay, there are two types of hormones are there. Okay, so endocrine hormones, exocrine. Mainly we have two classification. Those are endocrine and the exocrine. What are the endocrine? Okay, these are the chemical messengers which are directly poured into the bloodstream, and it means it doesn't have any ducts. These are also called as ductless glands. Okay, ductless glands which pour their secretions directly into the blood. Okay, directly దాని సబ్స్టెన్సెస్ని బ్లడ్కి పోర్ చేస్తుంది. ఆ బ్లడ్ త్రూ మన బాడీ పార్ట్స్కి సర్క్యులేట్, when it circulates throughout our body, it goes to different body parts, tissues, organs. Okay, those chemicals are utilized by the glands. Okay, by the body organs. Okay, these are the endocrine. Then what are the exocrine? It is exactly opposite to the endocrines, which have the ducts. Okay, it has the particular piping system or the ducts which pour their secretions into the ducts. Those ducts connected to the particular parts, those ducts, the hormones which are secreting to the particular part will help in the particular system of the body. Okay, these are the two types of hormones. Which are those? Endocrine and exocrine glands. We have two types of hormonal glands. Those are endocrine glands and the exocrine glands. Okay, so endocrine, exocrine, already you know about the endocrine and exocrine glands. Then what are the important hormones mainly important to our body? Those are, first one is the thyroid hormones. As you already aware of the thyroid hormone, right? Here nowadays so many of the women are suffering with the thyroidism. That is whether it is hypothyroidism or the hyperthyroidism. Okay, that is the first one, hypo or hyperthyroidism. That is the thyroid hormone which plays a very important role. Then second one is the insulin. Already you know about the insulin. It mainly acts, mainly we hear this hormone in the diabetic cases, right? So which is secreted by the pancreas. Okay, so insulin. Then estrogen which are secreted by the ovaries in the females. Then progesterone which are secreted by the testes in the males. Okay, then prolactin is also very important to feed a baby during the postpartum period in the mother. Okay, then as you know, serotonin. Okay, serotonin is also very important. Then cortisol. Okay, cortisol, adrenaline and the growth hormones. These are the important hormones. We'll discuss one by one. Whether the thyroid hormone, what is this thyroid hormone, what are the effects of thyroid hormone to your body, if it is depleted or it is increased production leads to which are the conditions, we'll know about the one by one. Okay, then first you should know the different Hormones cause different effects. Okay, the sum of the hormones which affects very early to the body. Okay, which affects very early to the body and it gives a work, but some of the hormones will take so much long. Example, growth hormone. Okay, so when you are born until your death, the growth hormones going to act in our body because it helps in growth and development. The growth is different, development is different. Okay, growth and development. So like this, the sum of the hormones acts on some different ways. Okay, these are the hormones. Then in case of depletion, okay, what is the depletion? Decrease. It leads to hypodepletion, which called as, ante, when it is decreased is called hypo, when it is increased production, hyper. Okay, so here you have to know the three things when you going to end up with a disease. What is this? First one is depletion. Depletion leads to deficiency. Deficiency leads to diseases. Okay, what is the depletion? Depletion is nothing but the particular, example, the thyroid hormone. I have a thyroid, it means my thyroid is not working properly, it is called depletion, right? Then what is next one? Deficiency. It's not properly producing the hormone, so only I am getting the deficiency. Okay, it is going to deficiency, so only I got a thyroid problem, whether it is hypothyroidism or the hyperthyroidism. Got it? So what is this? Depletion. Depletion leads to deficiency. Deficiency leads to డిసీజ్. ఓకే, అర్థమైంది కదండి. ఫస్ట్ ఏమవుతుంది? పర్టికులర్ గ్లాండ్ ఆ పర్టికులర్ హార్మోన్ని ప్రొడక్షన్ చేయడంలో తన వంతు సహాయం తను చేయలేకపోవడం, దట్ ఈస్ డిప్లీషన్. తక్కువ అయితే ఏమవుతుంది అక్కడ మనకి? ఆ ఫంక్షన్ పర్టికులర్ ఫంక్షన్ అవ్వడానికి డెఫిషియన్సీ వస్తుంది, అంటే ఎంత కావాలో అంత ప్రొడక్షన్ అవ్వట్లేదు. దీని నుంచి మనకి రోగం అనేది వస్తుంది. ఓకేనా? దీస్ ఆర్ ద 3 ఆస్పెక్ట్స్. ఇది గుర్తుపెట్టుకోండి, మీరు చాలా బాగా అర్థమవుతుందండి మీకు. ఓకే, ఇన్ కేస్ ఆఫ్ ఎనీ డిప్లీషన్ ఆర్ ఇంక్రీజ్డ్ సెక్రేషన్ అంటే మనం అక్కడ హైపో ఆర్ హైపర్ కేసెస్ అని చెప్తాం. ఓకే, హైపో అంటే తక్కువ ప్రొడక్షన్ చేస్తూ ఉంటుంది. గ్లాండ్ వర్క్ చేయడం లేదు అంటే నార్మల్గా వర్క్ చేయడమే వేరండి. హైపర్ అండ్ hypo, as I said, it's producing less or it's producing high or it's producing in the normal level. Okay, keep it in mind, hypo or hyper. Okay, and then we'll move on to the what is the thyroid hormone. Now what is the thyroid hormone? The name only suggests which helps in regulating the thyroid level. Okay, as you know, nowadays so many of the people are suffering with the thyroid problem, PCOS, PCOD, everything, right? So this is the thyroid hormone which secretes less or more. Okay, hypo or hyper, which leads to the thyroid imbalances. Then what are the hormones which secreted by the thyroid gland? Okay, T3, T4 and TSH. Okay, 3 levels we are going to see in the thyroid hormones. What are those? T3, T4, TSH, right? What is the T3? T3 is the triiodothyronine. The name of the T3 is triiodothyronine. Okay, triiodothyronine is the T3. Then T4 is thyroxine. T4 is the thyroxine. TSH is the thyroid stimulating hormone. Okay, this is the stimulating hormones which helps in secreting the both T3 and T4. Okay, so you will be having the thyroid gland here in the neck like a butterfly structure. Okay, when it going to affect in their function, it leads to the hypothyroidism or the hyperthyroidism. Okay, I need to tell very simply because everyone has to know the basic regarding the hormones. I can't go deep into the this subject because not it won't need to any others. Okay, so then what are the functions of thyroid hormone? First, think about the functions, because if you know about the functions, only you know whether it is what is the problematic conditions we'll get in the thyroid. Okay, what are the functions? It controls the metabolism. What is the metabolism? When we eat the food, right? When we eat the food, it goes into the digestive system. Then digestive in there, some of the enzymes will act. Okay, on that. Later, all the nutrients are absorbed by the small intestine. Then remaining parts will go to the large intestine. There, some of the water is absorbed, remaining fecal matter expels out. Then, remaining the absorbed nutrients which are absorbed by the intestine are going to get metabolized. Then, you will get a doubt that, madam, as you said, the thyroid hormone is present in the neck, but the nutrients are absorbed in the small intestine, right? Then the answer is here. I already said these are the chemical messengers which are acts in the particular situation in our body. So thyroid hormone also, which releases the T3 T4, which acts on the metabolism in the liver. Okay, so which controls the metabolism and regulates the weight. Okay, what, how it regulates the weight here is mainly the thyroid is helps in the iodine metabolism. As you said, iodine metabolism, uh, are you heard about thyroid cases? Okay, if you heard about thyroid cases, please do comment in the thyroid please do comment in comment box. Okay, here how it helps in maintaining the weight means the iodine. Okay, when we come across the patients which are suffering with the giddiness, when we check BP of that patient, the BP will be low. Immediately, for everyone, one thing comes in mind: please give salt water to particular person. Why salt water? Sodium. The salt is nothing but sodium, which helps in retention of water in our body. Okay, బాడీలో వాటర్ని అబ్జార్బ్ చేసుకుండి అలాగే ఉంచడానికి హెల్ప్ అవుతుందండి. సో ఈ ఎక్సెస్ అబ్జార్ప్షన్ ఆఫ్ వాటర్ are stimulated with the thyroid and excess water is expelled out. Okay, this is the mechanism. So when here we'll see the two conditions, hypothyroidism and hyperthyroidism. In hypothyroidism, what happens? The body is not properly secreting the thyroid hormones. What happens? I'm having more and more what salty products like pickles. Okay, excess salt if we are having, what happens? The excess amount of water is going to retained in the body. Okay, so those retained water will shifts to our body. Extracellular fluid, we'll call it as extracellular fluid. Okay, so extra, if it collected in the extracellular fluids, will become fat. Okay, so ఆల్రెడీ మీరు మీరేమి ఉంటారు కదండి, థైరాయిడ్ పేషెంట్స్ వెయిట్ గెయిన్ ఎక్కువ అవుతుంది అంటే డాక్టర్ మనకి ఫస్ట్ సజెస్ట్ చేసేది థైరాయిడ్ టెస్ట్, అవునా? సో దిస్ కాజెస్ ద హైపోథైరాయిడిజం. ఇన్ కేస్ ఆఫ్ హైపోథైరాయిడిజం, ద పర్సన్ is going to increase his or her weight. Okay, then in case of hyperthyroidism, what's happening? The gland is secreting more and more thyroid hormones. Okay, what happens? The amount what which your body want, in that excess of water is going to metabolized and you are becoming very lean. మెటబాలిజం ఎక్కువ అయిపోతుందండి. మెటబాలిజం ఎంత అయితే అంత ఉంటేనే క్యాలరీస్ అయ్యి మీ బాడీ వెయిట్ మెయింటైన్ అవుతుంది. ఓకే, ఇఫ్ The hormones are regulating more and more, metabolism is going more and more, the nutrients absorption is retaining less and less. More less. Okay, opposite అండి. More అయ్యే కొలది less అవుతుంది, less అయ్యే కొలది more అవుతుంది. Okay, so this helps in the weight management. Okay, then what is the next one? It also helps in the internal body temperature. How it helps in internal body temperature? Just think and correlate with what I said, right? If the body is getting dehydrated and excess amount of water is going out, which means what? Our body is getting more heat and heat. When we are hydrated, the body temperature is going to maintain. Okay, when we are going to hydrated, more and more body temperature will remain normal. When we are getting dehydrated, body temperature will rise. Okay, so this also important in regulating the temperature. Then even skin, hair. Okay, in order to maintain good skin and hair, you have to maintain the good thyroid levels. Okay, if these functions are altered, then we'll call it as a thyroid problem. Then what is the thyroid problem? Here we'll see the hypothyroidism or the hyperthyroidism. As I said already, hypo means decreased, hyper means increased, right? Then what is hypothyroidism? In case, just listen carefully, hypothyroidism means hypo decreasing, but the thyroid gland is producing more and more hormone. Okay, if it is producing more and more, the water content in your body is going to decrease less and less, so only we'll call it as hypo. Okay, so only water absorption is more and more, or we are becoming a fat in the hypothyroidism cases. Then what is hyper? It's what it is doing, it's secreting more and more, right? It's secreting more and more, water retention is going down and we are becoming lean. Okay, hypothyroidism and the hyperthyroidism, right? Always think in mind hypo and hyper. Here hypo means increased secretion, hyper means decreased secretion. ఓకే, అర్థమైంది కదండి. హైపో అంటే మీకు ఓకేనండి. సో డోంట్ గెట్ కన్ఫ్యూజ్డ్ విత్ ద హైపో అండ్ హైపర్. హియర్ హైపో అంటే మనకి వెయిట్ ఇంక్రీజ్ అవుతుంది, హైపర్ అంటే వెయిట్ డిక్రీజ్ అవుతుంది. ఎందుకంటే హైపో అంటే ప్రొడక్షన్ తక్కువ ఉంది కాబట్టి ప్రాపర్గా వాటర్ మెటబాలైజ్ అవ్వట్లేదు. అందుకే మన ఎక్స్ట్రా సెల్యులర్ బాడీలో మనకి water retention is going to happen, which leads to increased weight in case of hypo. In case of hyper, what happening? The gland is secreting more and more, the water is metabolizing more and more. So in extracellular fluid, how much amount of water should remain, it's not getting properly accumulated there, so only our weight is getting less and less. Okay na? సో అర్థమైంది కదండి డిఫరెన్స్ బిట్వీన్ ద హైపర్ అండ్ హైపోథైరాయిడిజం. సో ఇన్ కేస్ ఆఫ్ హైపర్, ఇంక్రీజ్డ్ మెటబాలిజం, దెన్ లెస్ డిక్రీజింగ్ వెయిట్. హైపోలో ఇంక్రీజింగ్ వెయిట్ బికాస్ ఆఫ్ లెస్ మెటబాలిజం. ఓకే, దెన్ in case of hyperthyroidism, we'll get the rapid irregular heartbeat also. Okay, the heartbeat, it should not be irregular because body metabolism is getting more and more in case of hyperthyroidism, which leads to increased weight gain unnappudu. When the weight is getting more and more, what's happening? Your body, in order to circulate and in order to provide the proper nutrition to your body, your heart is getting more and more pumped, so only it leads to irregular heartbeat. Then what is this? In case of excess of heartbeat, what you feel your own heartbeat, that is called palpitations. Okay, palpitations will be there, and increased appetite, Is it the increased appetite? Why? Because increasing the metabolism, which leads to the increased hungry. Okay, you'll feel increased appetite, then you will be having the swelling over your body because extracellular fluid is going to get increased, so swelling will be there. You'll feel fatigue, you'll feel very tired. Okay, fatigue will be there. Then muscle weakness. Okay, muscle weakness will be there. Then the brittle nails. Okay, brittle nails, this is in case of hyperthyroidism. Then in case of hypothyroidism, what will happen? Increased weight, right? I am the example of hypothyroid patient. Okay, I used to take the 50 mg of thyroxine, 50 micrograms of thyroxine hormonal tablet. Okay, because I used to, when I was pre just last 3 years back, I used to put on more and more weight. Okay, I got a doubt that whether I should have a thyroid imbalances, I think so. So I went to thyroid test. It concludes that I have a thyroid problem. I used to take 100 mg per day. Daily you have to take with a empty stomach. Okay, I used to take 100 mg. When I got conceived, my thyroid levels got more and more increased, more and more. I shifted to 175 micrograms during my pregnancy. After delivery, now I got reduced to 100. Now it is 50 micrograms. It suggests that it doesn't have any solution. Okay, it have a solution, it is in your hands. Okay, so take good diet, proper rest. As I said you already, in case of health, okay, the basic components of health. Okay, proper rest, proper nutrition, proper physical activity, reducing the stress, sleep at least 8 hours. Okay, if you maintain all these, you can maintain your imbalances in your body. Okay, with the medications. Okay, then what are the problems you are going to get in the hypothyroidism? Is increased weight. Increased weight leads to the water retention. Okay, water retention, you look very bubbly. Okay, you'll feel very fat. I used to like, yeah, I used to be like previous to 3 years back. Okay, increased weight, water retention. Then you'll feel constipated because the water is not properly using, right? So constipation, you'll feel the dry skin because the skin, even I said previously that the hormone which helps in the skinny also. Then you feel, I said you already, fluffy face you will get. Then you will feel very weakness. If you climb a 2 to 3 steps, I feel tired, like that you feel. Okay, so weakness will be there. Then hair fall, those who are suffering with the thyroid problem, they used to know. Okay, alopecia, the hair loss will be more and more, and you'll have more mood swings. Okay, used to be irritated more and more. Okay, mood swings will be there. Okay, these are the difference between hyper and the hypothyroidism. If you have any doubts, please do comment in the comment box. Okay, then what are the main reasons for a thyroid problem? Commonly, you say, what are the main reasons for thyroid problems? Here, mainly any infection and inflammation to the thyroid gland, which is called as thyroiditis. Okay, if any infection causes to the thyroid gland, it leads to the thyroid imbalances. Then, the too much intake of salt. Okay, please avoid too much intake of pickles. Okay, salted foods. Okay, too much intake of salt also, because the main function of thyroid gland is iodine metabolism. Okay, then thyroid surgery, in case of any thyroid surgery. Okay, next one is any medications which are many side effects of medications are, we know, while taking a medications, the doctor used to say you will have some dizziness or malaise, something like that. Okay, so any medications and radiation therapy in case of any thyroid cancers and all, used to take the thyroid surgery, sorry, this one, thyroid radiations, right? In case you will get the problems. Okay, okay na nachinda. Okay, are you like the topic, whether the thyroid is how we used to get the thyroid problems. Is there any doubts? Please don't hesitate to comment in the comment blocks. And first and foremost thing is that very thank you for the 100 subscribers. Thank you so much for this. Okay, next topic we'll discuss in the next video, that is about the insulin. What is insulin? Okay, thank you, bye bye. Please like the topic, share with your family and friends, and please do subscribe to my channel Shruthi Nursing Officer. Bye bye.